Good afternoon and welcome to Waco City Hall. We're on the third floor in the conference room, a new technology room that we use all the time now for our virtual programs and things. I'm Larry Holsey, Director of Municipal Information and Communication for the City of Waco, and I'm going to be your host for, this is our 39th press conference since this COVID pandemic began, bringing information I think that you as a public want to hear, and these gentlemen that I'm going ready to introduce to you in a moment are really the experts, and they want to bring it to you as well. Typically today we are also down in our studio on our first floor. We have an American Sign Language interpretation going on, and we also have a recording being made of a full Spanish interpretation of this. All the proceedings are going on, and always good to have us. Part of our introduction here is Hector Sabito, who is our District 2 City Council member, to invite our Spanish speakers to watch this later today at 4:30. Hector, thank you for being with us again.
Larry, as always, thank you so much for the invitation. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante toda la conferencia de prensa. Esta grabación completa en español reemplazará el sonido en inglés en el video, y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, as always, thank you so much for the invitation.
Well, thank you for bringing that important information, because we want our Hispanic population to hear this information too. Joining me today are on our panel, we have our Waco Mayor Kyle Deaver, McLennan County Judge Scott Felton, and joining us today from the Family Health Center is Dr. Ben Wilson, and back again this week, Dr. Mark Eliason from the Baylor Scott & White. Gentlemen, thank you again for being here and bringing us information. We're going to start with opening comments as we have in the past. Then we'll open it for, I'll read some questions that we've received through the last several days from the media. And then we do have two representatives from the local media that will ask some questions that may still be lingering on their minds. And then we'll let Mayor Deaver and Judge Felton wrap up. So let's start off. We're going the order of Dr. Ben Wilson first, and then followed by Dr. Mark Eliason, Judge Felton, and then Mayor Deaver. Dr. Ben Wilson from Family Health Center.
Yes, thank you, Larry. Mayor, Judge, thank you, everyone. I'm just going to go ahead and share my screen here and talk numbers and slides. Someone please speak up if you can't see the PowerPoint presentation. Okay, so just to go over some, excuse me just a second. Okay, so we're going to start off with some, some U.S. data. I don't have a graph for this this week, but just to give you some raw overall cumulative numbers. Again, these are cumulative numbers, so 8.1 million cases in the U.S. thus far, 219,000 deaths thus far. And then I'm going to actually jump to the very latest McLennan County data. As you can see listed here, we have 59 new cases in the last 24 hours, 9,632 total cases, 543 active cases, 8,943 estimated recovered cases, 49 hospitalized currently. 42 of these are McLennan County residents, 13 people on the vents. We had, unfortunately, 2 deaths today, and so that brings us to a total of 142 deaths total. Previously, I had a graph for positivity rate. I wasn't able to get that done for this week, but I will say that positivity rates, the 7-day rolling averages of those are 8.5% in Texas, which is overall pretty stable. The positivity rate in McLennan County is 5%. I've seen a couple different numbers on this, but the one I was going by was 5%. Overall, it seems to be at least stable, if not decreasing. I don't want us to have a false sense of security from that at all, though, based on the next slide I'm about to show. But I think that basically it has to do with what we call the denominator, or the amount of testing that we're doing. So here is what I like to, here's what I trust in a little bit more and go to more than the positivity rates, is the new cases per day per 100,000 people. This is since May 13th. You see the spike that happened in June and July, in large part due to Memorial Day and other factors. If you look over the last month, we are overall in the last month, our new cases per day per 100,000 people in McLennan County, which is the green line, is increasing. Texas, it is overall pretty stable. So we are increasing slightly. And certainly we're not having any kind of spike or surge like we did in late June, early July, but overall increasing some. I also do want to comment that I think that the increased detection of cases that are reflected in the slide, I think are in part maybe due to the surge testing, the community testing that's been happening. But I don't think that tells the whole picture. And as you can see, all along, we have been higher on this graph than the state for the most part. And so we have a lot of room for improvement here in McLennan County. So here is the effective reproduction rate that's been reported in past weeks. All this is just basically, are we overall increasing or decreasing? Statewide, we are slightly increasing at 1.14. Anything that is over 1 is considered to be increasing. The RT value, effective reproduction rate for McLennan County, is listed on this website as 1.0. I believe that is a little bit of a portending what's to come. So I'm hoping that our numbers will be going down in the near future, but time will truly tell. But it's fairly stable at 1.0. Again, I do think we're seeing a very slight increase in the new cases per day per 100,000 per the prior graph. And that is what I have for the slideshow. And I just wanted to, let me see, did I stop sharing? No, here we go. I just wanted to make a quick comment that we are having a free virtual town hall on October 27th that is sponsored by the Greater Waco Chamber of Commerce. This is for area businesses. Again, it's free. I'm participating, and we're hoping to increase communication and education for area businesses with things like paid leave and return to work days. Really just want to put more information in the hands of our area businesses. We're also going to have a legal expert on the call. And so just a quick commercial for that. I encourage all our area businesses to go to the Greater Waco Chamber website and go to the calendar of events, and you can do the drop down there and register for it. So back to you, Larry. Thank you.
Okay, thank you very much. Let's go now to Dr. Mark Eliason from Baylor Scott & White. Dr. Eliason.
Good afternoon, and glad to be back. Thank you for having me, Mayor and Judge. So a few comments. With this pandemic that we're experiencing, it has costed businesses a lot of money, and it's cost commerce, and it's cost some people their jobs and livelihood, and some people their lives. And what we're trying to do is find this balance of keeping people safe, but also keeping the economy going. And while it's difficult for everyone to make certain sacrifices, those sacrifices are necessary to keep people healthy and alive. I want to share just a few stories of patients. And again, I share these not by way of trying to scare people, but to motivate people to continue to comply with the safe precautions that we're encouraging people to do, which is social distancing and wearing masks and minimizing their close circle during this time. But before I do that, I want to again emphasize the numbers that Dr. Wilson just reported to us, and that means that we've had over 600 new cases just in the last week, and we've had several more deaths in McLennan County in the last week. The number of deaths in McLennan County is 142, and the number of cases is 9,632. That's a lot of sick people. When I have patients in the hospital, I will frequently ask them, do you know how you got this? And some do, and some don't. And some are completely perplexed because they think they've been safe. They think they've been socially distancing and only wearing a mask when they go out. I had one patient today who I asked, and she didn't have any insight as to why and how she had gotten COVID. And so I asked her, how'd you get this? And she said, I don't know. And I said, well, where do you go? and she explained to me all the places that she goes, which isn't very many. She says, the only place I go without my mask is church. And so, maybe she didn't get it at church, but maybe she did. But again, the wearing of masks is shown to be protective. It's not 100%, but it's better than no mask at all. Another quick story, my nephew is a high school student in a different city, and he too has been very good about wearing a mask, but recently caught COVID. And as I was asking him about his potential exposure, he explained to me that he was at a flea market outside, and so he thought he was safe and didn't wear a mask, and 3 days later became sick. So again, outside activities are safer, but still wearing a mask is very important. Just a few more examples of patients who have reported to me just how tough this is on them. And even though they're doing reasonably well, I've had a few patients tell me that they thought this would just be like the flu, and sadly have realized that it's much more than just the flu. This is very difficult. One patient told me, and he's not unique, but one patient just this week told me that it takes him 10 minutes to catch his breath after just sitting up using the bed control to sit him up. So this is assisted sitting up, just takes his breath away. And another patient told me this is the hardest thing she's ever done. And I thought her disease course was rather mild on the spectrum. So again, just words of encouragement. Please, please, please be safe. Please be wise. Please protect yourself and others by wearing your masks. Thanks again for having me.
Thank you, Dr. Lyson. Judge Scott Felton. Judge?
Good evening, everyone. Good afternoon, rather. Hope everyone's doing good and surviving all of this. I appreciate what Dr. Lyson was just saying about particular examples of, and I think that helps us to really get real life examples about what's actually going on. And the more of those stories that we can share, the better to kind of really understand how vast the situation is or how severe it might be. Just to let you know, and as usual, details, the mayor always does a great job in handling the details, but I'll mention some high points. As you know, the surge testing is underway, and it may take a few more days to see what kind of effects it's having on the results of how many people positive with COVID-19 show up. And but those are good examples about tools that we're trying to use to understand the best way to handle this situation. Early voting is big right now. It's I think maybe record for early voting. There's lots of people here. I've watched from some fairly close distance. It looks like most everyone's wearing a mask coming in that is coming to vote. I haven't heard of any arguments or things like that about people not having masks on or us wanting us to come over and be involved in it, but it's going on pretty briskly right now. The other thing is we will be sending, some jury notices have gone out. Judicial process will start going. That's we're hoping people will participate. We think that our protocols should ensure them to be safe in this duty that they have to help us in the judicial process in our local community. So we are working with that. The other thing that Dr. Lyson said about the term he used was balance with what's going on, not only just the efforts that we do go through to avoid catching the virus, but also the other things that we do to make lives as normal as we can. The economy here is really, and generally as a whole, is pretty good, but there's isolated or other businesses that are going through really hard times right now. So, there's been some recent announcements about some openings with Amazon coming to town. There'll be more details about that later. So there's still some positive things happening. There's a lot of, I'm reading the questions that were posed, and I'll be glad to handle those as they come to me. Thank you.
Thank you, Judge. Welcome, Mayor Kyle Deaver. Mayor Deaver.
Good afternoon, everyone. Thank you for joining us, as always. The main thing I want to talk about again today is this free surge testing that we've got available. This is an extraordinary resource that has been provided to us through the federal and state governments, and is being stood up by our local EOC and health district and others. And it is just a rare opportunity in a time where most communities have not had adequate testing, and we have certainly not. We do now. And so if you can go get a test, you do not have to have symptoms. There's no screening. You are asked whether you have symptoms, but that does not determine whether you can take the test. That is used to for us to be able to figure out how many of those that are getting tested that have that come back positive were asymptomatic. So don't be thrown off by the fact that you were asked at the beginning of the registration process what symptoms you may have had. But we have that going on at 3 or 4 sites every day across the city. And all you have to do is go to covidwaco.com and click on free COVID testing to see the dates and register. We're also currently offering a new saliva test at Heritage Square in downtown Waco. So it's not a nasal test, and people have been very impressed with that test that have taken it. I can tell you that having taken the nasal test, it's not a big deal. It is a self-administered test. So you actually swab your own nostrils. It is not the deep swab. You don't have to force it way up inside your nose. And there is a proctor who is a nurse who is watching you to be sure that you do the test properly. It's 3 to 5 seconds in each nostril. It is really quick and easy. And I just can't overemphasize the importance of all of us going to get tested. We still have significant community spread in Waco and Putnam County. And by going to get tested, you can find out whether you may be one of the persons who is spreading the disease without having symptoms. And once you know that, you can protect those around you. Baylor is really doing a great job with this. They have asked 5,000 students to get tested using our surge testing. They started yesterday, and they're trying to test 500 students each day. Monday they tested 492, and yesterday I believe they tested 494. So they're getting very good responses from the students. And that will really make a difference in our community if we can get more and more people to go do that and help us to find the asymptomatic spreaders of COVID. As you all know, week from Saturday is Halloween. That is a major concern. And the CDC has put out great recommendations for all the upcoming holidays. We're going to talk a little bit more about Halloween based on one of the questions we've received from the press. So I'll save that. But I would just encourage you all to Google CDC holiday, and you'll find recommendations for all the upcoming holidays about how you can you can enjoy these holidays in a different way and keep yourself safe, keep your family and our communities safe. If we could, let's go to the slides, Julie. We'll start with this first slide, which is our cumulative cases, showing that this is since June 1 again. Our new cases continue to rise every day at a very steady rate. We passed 9,500 total cases on Monday, and we'll probably top 10,000 cumulative cases before this time next week. Next slide. We've been averaging between 50 and 70 new cases per day for the last 5 weeks. As of yesterday, our 7-day average was 64 new cases per day. At this time last week, we were at 65, so we don't have an increase this week. But that number of cases, as Dr. Wilson pointed out, on a per capita basis is still way too high. We should not have that many cases each day in a community our size, and we've got to continue to drive those down. The ways we can do that is to be vigilant about wearing masks and social distancing and and hand washing, but also by taking advantage of this testing to try to find asymptomatic carriers. We just must continue to be vigilant to suppress the spread of this virus until we have better therapeutic treatments and or effective vaccines. Next slide is Baylor continues to do really well managing the spread of the coronavirus on its campus. We talked last week about the fact that they had an event in the athletic department that had caused a bump up, but they have that under control now. They reported to us today that they have had 5 days in a row now with no athletes testing positive, and they are back to averaging less than 10 new cases per day. So that's really good news. And it affects our community. That's why I keep talking about it, because that's a big population in our community. And I commend Baylor's staff and their administration and their students on the way that they're conducting themselves and keeping that spread at a very low rate on campus. Next slide is our hospitalization rates. And our hospitalization rates continue to be concerning in terms of the number of COVID patients who are requiring hospitalization. We continue to see between 50 and 60 hospitalized patients each day, and relatively high numbers of patients requiring ventilators. And the number of deaths that we are having, which we'll go to slide 5, we had 12 more McLennan County residents this past week lose their lives to COVID-19. It's the third week out of 4 in which we've had 10 or more fatalities from COVID-19. In all, we've now lost 142 of our friends and neighbors to this virus. It's taking a very hard toll on McLennan County residents, and we owe it to each other to be as vigilant as we can to slow the spread of this virus until vaccines and better treatments can be developed. That's all I have for now, Larry, and I'll turn it back over to you for questions.
Okay, very good. I have a number of questions that we've picked up from various media who is subject. First one is, how many people have been tested through the surge testing sites and how many tests were positive?
I have those numbers, Larry. Through yesterday, I believe, it was 5,696 tests that have been completed. And we've received a little under 2,000 results at the health district so far of those. 137 of those 1973 have been positive. So that's a 7.3 positivity rate on the tests that have been completed. It appears that the lab that is providing these results is getting the results more quickly to the persons who are being tested than to our health district. We're continuing to work on that reporting mechanism and trying to get those results reported to the health district as quickly as possible.
Okay. What other kind of information has the health district been able to glean from the surge testing?
Dr. Wilson, would you mind speaking to that?
Yes, I do know that the overall positivity rate among the surge testing that's been happening is 7.3%, which is not dramatically different from our county positivity rate. So I don't know that there's too much revealing there. I would like to know how well it helps us capture our overall what we call prevalence in the county, and I'm not sure of that. I don't know that it's changed our estimates a whole lot of prevalence, but I don't have that information. And so what I will say, just to sort of get away from the statistics and move to the practicalities, is that the reason that we're doing that, even apart from necessarily what the statistics show, is that we just need to detect every case that we can. Every case that we detect is another case that we can do contact tracing on, research who that person has been around in order to, and have them quarantine in order to help stop the spread in the county. And so that's the significance of it. I don't know, I would be doubtful that it would change the statistics a whole lot based on our previous estimates that we had before surge testing. But the practical take-home points for every case that can be detected, needs to be detected, is the main thing there.
And I can add a couple of things to that. We've had, of the 137 positive results so far, 41 of those people were asymptomatic. So it is, we are getting, as you would expect, I think, a higher percentage of those who are coming in with symptoms are testing positive. But there still are, we've picked up 41 so far. And the more of those we can pick up, as Dr. Wilson pointed out, the better off we are in terms of slowing the spread.
This next question kind of deals with that. How many more tests does the county need to conduct to be able to get a clear snapshot of the local COVID situation?
Dr. Wilson, would you speak to that too, please?
Yes. So this is kind of similar to what I was talking about. I think the statistic term that we use behind this question is really the prevalence, or truly how much COVID do we have in our county. I don't, as I said in the previous question, I'm not sure how much the surge testing has changed our estimate of the prevalence in our county. I would doubt that it's changed it a whole lot, but I'm not positive. So I think that the clear snapshot that we already have a clear snapshot though, and that is that our county numbers, cases per day per 100,000 are higher than the state numbers, and it's something that we really need to work on through all of our measures to decrease transmission that we consistently harp on, such as masking and other things. So I would also say that any measured case, any case we detect, of course, we are, to be fair, guessing less than we were than if we were just doing statistical calculations. So in that sense, it does help us get firmer numbers, but I just don't think that those numbers have changed a whole lot versus the estimates we had prior to surge testing.
Okay. Many national news articles indicate that the country is approaching a second wave or spike. How close is McLennan County to seeing a second wave?
Dr. Eliason, would you mind taking a stab at that?
Yeah, so we are seeing an increase in cases, and I'll tell you, at least in the hospital, it feels like we're certainly seeing a lot more cases. At least at Hillcrest, our numbers have increased quite a bit, almost double what it was a month ago. But in the community, we're seeing a slight increase, not to the degree that we would call it a spike or a surge. But we often always don't get that kind of warning. We are staying pretty consistent with our RT number. Again, that number is how many people does one person who's infected, do they pass it on to, or how many people do they infect? And for right now, that number is sitting right at 1, which means we're very stable. We're not exponentially spreading, but that could change at any moment. I am certainly keeping my eye on the world and the country, and in Europe, they're certainly seeing what looks like a second spike or a second wave. And that could be us next week or next month or in 2 months from now if we're not careful. And again, going back to the importance of the surge testing, trying to identify asymptomatic spreaders or people who do have it, so we can stop the spread. And then, of course, all the preventive and precautionary measures that we're insisting upon are very helpful.
Okay. At what point will McLennan County implement stronger mandates such as stay-at-home orders?
Judge Felton, would you mind speaking to that?
Yes. Well, as you may recall, that actually sometime back the governor has kind of taken the reins in regards to what the orders may be in any particular place, and used, which I thought was good, used some different baselines to determine what action needs to be taken. One had to do with the hospitalization rate, the percentage of people infected with the coronavirus relative to the total beds. And that has to be 15% or less, or under 15%. If it's below 15%, then restaurants and businesses could be at 75% capacity. If we were to go over that amount, then we would have to drop below to 50%. Also, he looks at the positivity rate and some other factors as well in doing that. But I doubt that the governor is going to change that where the locals make the decision on that. I'll say this, it would be awful hard for me to impose a stay-at-home order. I'd have to have a lot more information than I have right now. Thank you.
Okay. What is the threshold for when we know COVID is spreading exponentially again?
Dr. Wilson, I think you've spoken to this a little bit, but if you could speak to that. Thank you.
Yes, I agree with what Dr. Eliason said, that the RT value greater than 1 means that exponential spread is happening. Ours is exactly equal to 1 right now. So we're a bit non-committal in our RT value, as it were. But I think that I'm unable to show a graph of this, but the graph that you showed of overall number of cases of time in our county, Mayor, at the beginning of your presentation, I think is helpful. If you could just sort of, if the viewers could sort of just imagine, if you would, if the line is going like this and it's straight, but it's going up, the overall number of cases over time, then that is not exponential. If it's doing this and there's a bend in it going up, then it's exponential. And so there's not necessarily, there's a threshold, I would say, is RT greater than 1. But I think I don't want us to get too caught up, based on just go back to previous comments. I don't want us to get too caught up on whether the curve is exponential or not. The overall number of cases per day, we need to get that number down as well. And so whether the growth is exponential or not, we still have more cases per day than the state does on average. And so we need to work on that number apart from whether the growth is exponential or not.
Okay. What would it take for the county to order schools closed? Some school districts continue to struggle with outbreaks and mass quarantines, resulting in staff shortages and some closures.
Judge Felton.
Well, I mentioned before, the more than likely that would be called by the governor. But, of course, if staff shortages happen, that's something that could really create how would schools operate if they didn't have enough staff to do so. But I think that we always need to take in consideration the psychological effects some of these kids have by not being in school, not socializing in their groups, not being checked for health issues, things like that. Also, it seems to be, and I know by fact by talking to law enforcement and others, that the large amount of unsupervised children is causing a problem as well. And so, where are they safer? Because there's some, very bad things can happen for unsupervised use. So I think you have to look at the whole picture. Balance, as Dr. Lyson said earlier, is something that we always have to take into consideration. And, again, I would struggle making a across the board decision to do something like closing schools.
Okay, here's the Halloween question. How should people celebrate Halloween this year, and should trick-or-treating be canceled?
Dr. Lyson, would you take that? I may have a couple of follow-ups too.
You bet. Yeah, so the mayor did mention the CDC's recommendations, and they have some great, very detailed information. If you'll just search on the internet, CDC holiday, and you can scroll down through those, and they have different recommendations for different activities, but there's a section for Halloween, and there's also an expanded section on Halloween. I'll just speak to a few of those recommendations, but I do encourage you to go read those recommendations for yourself and decide what makes the most sense for you and what seems doable for your proposed manner of celebrating Halloween. Certainly love Halloween myself, and I would hate to see Halloween canceled, but I think there are some things that people can do to make it safer and to minimize risk. One of the recommendations is to not forego a cloth mask. So many costumes will have a plastic or incorporated sort of mask. And so they are recommending not using that mask, but instead using a cloth mask. The plastic masks don't stick close to your face, and they do allow air particles, including COVID-19 viruses, to be inhaled and breathed. So please use a cloth mask. Second recommendation that they use, which is a strong recommendation, is to not have indoor costume parties. We know that if people are in close proximity, again, social distancing, having a perimeter of 6 feet around you is the safest space. And if people climb into a room and they're wearing costumes and having lots of fun, judgment may go out the window. And so again, limiting the space around you or expanding it to 6 feet and reducing indoor activities. And then they're also mentioning that, the traditional come to the door, knock, and somebody hands you a treat is higher risk. Doesn't mean you still can't go door to door, but one recommendation that they make to moderate that risk is for people who are giving out treats to prepare treats or bags of goodies that they prepare themselves after washing their hands for 20 seconds using soap and water. Prepare those bags, and you can leave them for trick-or-treaters, or you can kind of proctor them, keeping your distance. But again, keeping your distance of 6 feet and maybe having those goodies at the end of a driveway or at the edge of your property, instead of having people coming up to your door where there's a smaller space. There may be 2 or 3 or 4 or 5, 6 trick-or-treaters talking to them. So again, I reference you and encourage you to go back to the CDC's recommendations and that CDC holiday to read those in detail. Thank you.
Yeah, thank you, Dr. Elias. And as to the question about whether Halloween should be canceled, I mean, I think that's, we've talked about it a couple of times. Dr. Elias has and Judge Felton has. I mean, you've got to strike a balance here. And if we start canceling too many things at this point in the game, I think you start losing people's support, and they don't want, you end up losing the game in the long run. And I think there are ways that this can be done safely. I would strongly discourage people from doing traditional trick-or-treating. You know, think about staying home and carving a pumpkin or starting a new Halloween tradition with your family. But as far as a ban on trick-or-treating, I don't expect that to happen this year.
Okay. It's been a week since bars were allowed to reopen. Has this caused coronavirus cases to spike in McLennan County?
Dr. Wilson, can you speak to that?
Yes. So yeah, it has been a week since they reopened. I think it's premature to know really what's going to happen because of that event. I wouldn't have expected us to see a lot of difference one way or the other just within a 1 week time frame. I don't know if there are enough bars here in the county to even within the next few weeks, you know, not just this first week, but the next few weeks, to where that we have enough bars to where even if everyone, heaven forbid, went flooding to the bars, would just the sheer number of bars we had, would that be enough to increase the county's numbers appreciably? And I'm not sure about that. Here's what I can tell you, though, and this is a study from the CDC that was published in September. It was an interesting study that basically charted out 160 people that were diagnosed with coronavirus. And then it looked backwards or retrospectively 2 weeks back to see what kind of activities they had been engaging in over the last 2 weeks. And so the options for activities were things that you would predict: eating indoors, bars, going to bars, going to church, public transportation, that sort of thing, just work, everyday life. And so it looked and said, okay, of all these 160 people, how likely was it that each one of these people did one of these daily activities that many of us do frequently? And so it showed that basically of all those activities that I just mentioned, and then others, the ones that people were most likely to have done were going to indoor restaurants and bars, unfortunately. So I wish I could, I know we all like making merry and you know, getting some food and having a great time with our friends, but at least per this study, that those two things, indoor restaurants and bars, are the highest risk of many of the activities that we could engage in, again, including public transportation and work and some of those things. And I do think that none of us should get a false sense of security based on being outside as well. Even if you do an outdoor restaurant, you know, you need to be wearing a mask as much as possible. Bars make it particularly high risk, and indoor restaurants, because people are eating and not wearing a mask. And so we have to remember these things. Judge, I didn't know if you also had a comment. You and I had discussed this previously.
Yeah, and thank you for bringing that up. And I don't doubt the data on that as you reported it either. But before making the decision, we had done a certain amount of analysis, although it's been very hard to get good numbers from TBAC. But many of these bars had converted to both restaurant or a bar/restaurant and got their certification changed. So a lot of that change had already happened. Those bars, many of them had already shifted to more the restaurant bar type, but with the protocols that came with it, which is spaced out seating. So, if you're going to have it, at least it was put into a safer scenario. The remaining bars, and one other thing on that, many of the patrons that had attended these places, of course, transferred over and followed these other restaurant/bars or restaurants that were already operating that served adult beverages and had to comply with those protocols. Now, the remaining bars that opened, they could only open at 50% capacity, no dance floors, and stop serving at 11 o'clock. But we don't feel like there was a large number of people or places affected by the change that hadn't already happened sometimes back. But, as I said before, I stand by. I don't make an order or a rule and turn around and walk off from it if we see things need to change, and we're going to talk about it again. Thank you.
Okay, the final question I've received this week from the media, before we go to those who are on the phone. Masks have been mandatory for several months now. Is this going to change anytime soon?
Well, Larry, as Judge Felton mentioned earlier, the governor has issued a lot of these orders, and at this point, there is a governor's order for masks as well as a city order for masks. And so, even if we lifted our order, the governor's order would still be in place. I will say that I hope he does not lift the mask order. I think that is the one thing that is the most painless way we can continue to operate and keep our businesses open and reopen our economy. The mask is a pro-business thing, and it's very unfortunate that it has been politicized. But I expect the governor will probably leave the mask order in place until we get to the point of finding vaccines, developing vaccines, and better therapeutic drugs.
All right. Now let's turn to those people who have registered. We did open to the media, to anybody from the media representative would be able to join us. We have two representatives. We have Drake Lawson from KWTX News 10, and we have Brooke Crum from the Waco Tribune Herald. So, Drake, are you on the line? If so, go ahead and ask your first question.
Yes, sir. I'm here. Can you hear me okay?
Sure do. Go ahead.
Okay, perfect. I just wanted to, I know that this was explained in detail, but maybe just a direct answer on this. The surge testing, I know that we're still waiting on it. You mentioned that there's been 5,000 tests, but I think 2,000 are back. Is it concern with the surge testing, or is it a concern that we don't get them back in a timely manner, or is that a timely manner? And what is the time frame on getting those tests back to really make an impact?
Well, we had a discussion about that this morning. We think that most of the people who are being tested are getting their results directly back from the lab within 2 to 3 days. And so hopefully they are then taking the appropriate actions to isolate themselves and to contact their close contacts and let them know that they need to quarantine. But it is a concern that we're not getting them at the health district as quickly as we would like to get them. We would like to get them just that fast at the health district so that our teams can get in touch with the person who has tested positive and do the appropriate contact tracing. I think, the health district is still trying to iron that out with the testing company and hopes to have that in better shape in the next few days. Dr. Eliason or Dr. Wilson, would you like to comment on how important it is to get those results back quickly?
I can say something about that. The quicker the better, for sure. There's something about having that test result in someone's hand, which really drives home the need to isolate yourself when you have the test result in your hand. And so, yeah, certainly the quicker the better.
Good. Say the same thing. Just as soon as somebody has that information, they know how to behave, and they're, again, motivated to comply if they're sick.
Great. Thank you.
Okay, Drake, you'll have another shot in a minute. Brooke Crum from the Waco Tribune Herald. Are you on the line?
Yes, I am.
Okay.
Hello.
Ask a question.
Yes, about the schools. So I've heard from, many teachers, they're very concerned. There's not enough room in their classrooms to social distance as more students have returned to the classroom, particularly Waco ISD in the second 6 weeks. Students have been sent to school while they're sick with COVID, and you're saying there's nothing that the county, the city can do to help these people. I mean, there's, correct me if I'm wrong, but I thought the health authority could issue an order if there were an outbreak. You keep talking about striking a balance, but what's the cost if the balance is people's lives and their livelihoods?
I think that's a fair question, Brooke, and a good question, and it's really difficult for us to answer that. There's been a lot of lack of clarity from the state about when a health authority can institute a shutdown of a school district, and it wouldn't be, I don't believe that they would allow it countywide at this point unless you had an outbreak across the county. So I don't think that our health authority, Dr. Werner, has seen what he would consider to be a serious outbreak at this point in order to shut things down. I think the most we've heard about, Judge, correct me if I'm remembering this wrong, is no more than 3 students in any given school that have tested positive and it had shown any kind of spread at the school itself. So look, going to school poses a risk. We know that. Judge Felton also correctly said keeping kids out of school poses a risk too. And so I am sympathetic to those teachers. I'm sympathetic to the parents who don't want to put their kids in school. I think those parents, to a large degree, have options at most schools. The teachers, not so much. And so it's a real challenge. And all I can say is we're going to continue to watch it and do what we can to try to keep people as safe as we can while we try to push through this difficult time.
Okay, let's go back to Drake Lawson. Drake, do you have another question?
Yes, I had one more question. It was regarding McLennan County reporting the deaths. I know that in McLennan County, we have reported deaths almost daily. It was mentioned at the beginning, but other Central Texas counties haven't been reporting those deaths. Is there a reason for this? Does it have something to do with the hospitals maybe having patients from other counties, or what is a factor that leads to there being more death total in McLennan as opposed to other Central Texas counties?
Dr. Eliason, do you have any insight on that from the hospital standpoint?
Yeah, I don't know how that data is collected and reported. I can only tell you when we have a patient in our hospital who passes from COVID. And I don't know if those tallies are being made after the death certificate is signed or if it's at the time of death, because there is a delay from the time of death to the signature of a death certificate, and that delay can sometimes be a week. So I just don't have the answer for you. I don't know.
Okay.
I don't have anything to add to that. Judge, do you?
I do not.
Okay, thank you.
Okay, Brooke Crum, do you have another question? Brooke, are you on the line?
Yes. So as we're seeing more places open up, have we received any more complaints from businesses not complying, bars not complying, that sort of thing? And if people do see places not complying with the protocols, what should they do?
Brooke, I'm not aware of any increase in complaints, but I have not asked that question in the last few days. And so I will ask it, and if I find out that that's inaccurate, I will let you know. If people see situations that they think are unsafe, as Judge Felton has always recommended, the first thing they should do is leave. But also, we would appreciate it if you would go to covidwaco.com and you'll find the phone number there to call with concerns about businesses. And we will go and take a look and see what's happening,
Right.
see whether they are in fact complying with the orders and with the restrictions that they're supposed to be operating in. I want to follow up, Brooke, on a question that you asked 3 or 4 weeks ago, and I'm sorry it's taken this long to get this information to you, but you were asking a while back about hospital admissions and discharges and deaths. And so far, as of yesterday in McLennan County, we've had 966 total hospital admissions that were diagnosed with COVID. It doesn't mean they all came in for COVID, but they were diagnosed with COVID at some time during their stay. I think most of those did come in with that being their first complaint, but you obviously have other people who are in for other issues and ultimately test positive. Out of that 956, we have 789 who have been discharged and 136 who have died. And what you have to recognize there is that that's not just McLennan County residents. Okay, that's all the people that have been in our hospitals from McLennan County and surrounding counties. So I just wanted to share that with you. I apologize again, it's taken us a little while to get that answer to you. But I want to say to you and to Drake and to all the members of the media how much we appreciate you all taking the time to be here to ask questions live and also to submit questions ahead of time. I think it's really important, and y'all have been extremely helpful in trying to get the word out on what's happening with our response to the pandemic.
Okay, thank you both, Drake and Brooke, for being a part of our call-in portion of that. We'll get to wrap up here now. We're going to have final comments from Judge Scott Felton and then Mayor Kyle Deaver. We'll start with you, Judge.
Okay, thank you. One of the things that we struggle with, and we kind of hit all around it in this conversation, is what are the effects of our action? You know, what worked and what's not working. And, you know, although it seems like we've been in this situation, you know, a long, long time, it's really, you know, started back in March. And so you have to get a certain amount of level of data before you can come to a lot of those conclusions. And there are a lot of statistics out there, but, you know, we look on how we compare with other counties, and some of those counties I know have done exactly the same thing that we've done. They've been pretty much in lockstep with us or us with them, and, you know, same size, demographics similar and all those. And so I'm struggling with that. I'd like to, you know, try to, if possible, even ask for outside help in that regard to make sure that when we ask people to do something, that it's gonna have a positive effect. You know, one thing that if you want to find a reason not to do something, you don't, you know, you can look around. There'll be some report or something out there that you can latch on to and say, you know, that's what you're going to buy into. But the one I don't understand is why people wouldn't go ahead and wear the mask. You know, doctors and nurses and medical people have been wearing masks for, I bet, 100 years. And they wouldn't be doing it if it's because it's not that fun. And most of them don't look better. And so they wouldn't be doing that if it wasn't the right thing to do. So they're trying to protect their patients from anything they might have, and vice versa. They see sick people, and it gives them a certain amount of protection. So I'm buying into that. And, you know, I think that's just too easy to do it. Although I don't like it, didn't feel good, it's still a very easy thing to do in that regard. But again, you know, that's back to the personal responsibility. So, you know, you can go pick out something that doesn't fall in line with everybody else, but what's that doing with the whole effort in the community? So, you know, let's try to be a community player, I guess you'd call it, and try to fight this thing on the best grounds we can. And there again, don't go into places that you're not safe in. And if that place does not value your health, then you don't need to be going in there. And the one other thing that I've noticed where it's easy to let your guard down is really close social settings like family or even real close friends. And you get it in your mind that, you know, their friends or family, they wouldn't cause me a problem. And so you let your guard down. I'd have to say that, you know, I'm probably guilty of that from time to time too. But in the contact tracing that we're trying to rely on, that does show to be a big source of where the transmission happens. So, you know, really watch that and talk to your friends and family about that. Thank you.
Thank you, Judge. Mayor Kyle Deaver. Mayor Deaver.
Thank you, Larry. I want to thank our panelists again for being here today. Judge Felton, always great to have you and get your perspective. And it's always wise. And I can't believe you let us get away without telling us to shop local and pray often. But I'll say it for you.
Thank you.
Dr. Wilson and Dr. Eliason, you guys always do a great job, and really appreciate y'all being here and sharing the medical perspective. It's so important for people to be able to hear from our medical experts about this pandemic and how we can best deal with it. And you guys you really do a good job. And I appreciate too, as Judge Felton said, the personal stories, Dr. Eliason, and recognizing that what we're trying to do is help people understand and make it a little more real for them. And then Larry and Julie and Kelly and your teams at the Municipal Information Office and the Health District and the City Secretary's Office, thank you all again for your time and effort to make this happen each week. I want to say that I don't want to let a press conference go by without mentioning flu shots. Get your flu shot, even if you normally don't. It is for your good and for the good of the community, because we do not need to have our hospitals becoming overwhelmed with flu at the same time they're dealing with COVID. And so we hope that we will have a lower prevalence of flu because everybody's being more careful this year. But the best way to protect yourself is to get that shot. And then please get tested for your good, for your family, for your community. Go to covidwaco.com and register for a test. I want to thank you all for continuing to wear your masks and being vigilant about the recommended safety measures. Please continue to try to maintain that physical distance from others who are not in your household, and stay home when you can. Take care of yourself and take care of one another. We're getting through this together. Thank you.
Thank you. I want to thank, obviously, you guys are the authorities we count on, and we appreciate your time and effort. And I want to remind everybody that today at 4:30, we will have a replay in Spanish. And this will also replay on our channel tonight at 7 o'clock in English. It's also available on demand right away, probably by 4:30 or so, or 4 o'clock. If someone just getting home from work, they can go and they can go to our website and they can watch it there too. I want to kind of close with a positive thing. Tomorrow morning at 10 o'clock, we're going to have a virtual groundbreaking for the big renovation of the Waco Suspension Bridge. We want you to be a part of that. It's a big part of our history, and I want you to be a part of that as well. So. We hope that you had gotten information from this, and we will see you next week right here at 1:30, first floor conference room from City Hall. Have a good afternoon.